Good day, Wonder Nurses. I'm Nurse Anne. Our video for today is about community health nursing, specifically on COPAR. I will share with you what are the important information that you need to remember that will be beneficial for your examination. So if you're ready, let's start. COPAR, or the Community Organizing Participatory Action Research. It is a strategy used to implement primary healthcare delivery in depressed and underserved communities to assist them to become self-reliant. What is community organizing? It is a continuous and sustained process of educating the people to let them understand and develop their critical awareness of the existing conditions. Let's now proceed to the phases of COPAR and what are the main activities in each phase. First, we have pre-entry phase. The activities in this phase are done before going or interacting with the community people. During this phase, we will conduct community consultations or dialogues. We also set issues or considerations related to site selection. In this activity, we develop criteria for site selection. The majority of the community population must be socio-economically depressed and underserved. The community is in poor health status and health services are inaccessible. Aside from this, it must be safe and there is acceptance of the program in the community. Then after a thorough review, we will proceed to site selection. Then, we will conduct a preliminary social investigation. In this activity, we will use secondary data from various government offices. Then we will also conduct ocular observations in the chosen site. Lastly is networking with local government units and NGOs. Next is entry phase. It is the integration with the community residents and the arrival in the community. During this phase, we will do sensitization of the community and information campaigns, then continuing social investigation. Core group formation is also done in this phase. We develop criteria for the selection of core group members, as well as defining the roles, functions, tasks of the core group. Next is coordination, dialogue, consultation with other community organizations. Lastly is the self-awareness and leadership training, or SALT. This activity will help each other to discover their potentials and talents that can aid in the growth and development of the entire community. The third phase is community study, or diagnosis, or research phase. In this phase, we will develop a research team and train them on data collection methods and techniques. Planning for the actual gathering of data, then we will proceed to data gathering. Next is training on data validation, then community validation. After that is the presentation of community study, or diagnosis and recommendation. Finally is the prioritization of community needs or problems for action. Fourth, community action phase. During this phase, the organization and training of community health workers take place. We develop criteria for the selection of CHWs and train them. Next is setting up linkages, or network referral systems. Then, project implementation, monitoring, and evaluation of health services or intervention schemes and community development projects. Lastly is the initial identification and implementation of resource mobilization schemes. Fifth phase, community organizing and capability building phase. We do community meetings to draw up guidelines for the organization of the CHO. Then, we will elect officers. Next is the development of management systems and procedures, including delineation of the rules, functions, and tasks of officers and members of the CHO. We will also conduct team building or action reflection action session, working out legal requirements for the establishment of the CHO. Finally, organization of working committees and task groups, training of CHO officers or community leaders. Finally is the sustenance and strengthening phase. This is done by the people. These are the activities: formulation and ratification of constitution and bylaws, identification and development of secondary leaders, formalizing and institutionalizing of linkages, networks, and referral systems, continuing education of community leaders, CHWs and CHO members, and community residents. Lastly, develop medium and long-term community and development plans.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.